Good evening. Welcome to our 7th webinar now in our Open Wide Our Hearts series based on the Bishop's Pastoral Letter Against Racism. My name is Lynn Campbell and I'm the Director of the Office for Catholic Social Justice Ministry. And tonight's webinar is on the influence of racism in the healthcare system. And certainly we've all seen that COVID-19 has really revealed some inequities in our healthcare system. So hopefully we are bringing you a very timely event. This evening we have some panelists who are going to share their personal experiences. They work in the healthcare system, and we're going to talk about what their personal experiences, what can be done for a more just healthcare system, and racism as a public health issue. So thank them all for being here this evening. Thank you for joining us again. As we know, you've been coming to many of our webinars. And with me this evening is Kay Taylor Brooks. So Kay has been a faithful member of my committee putting this together and has really helped with this workshop as well. And so we're going to invite Kay to lead us in an opening prayer.
This prayer is for those who are sick and for healthcare workers. Gracious God, source of life and health, Jesus came to our disordered world to make your people whole. Send your Spirit on those who are sick and all who minister to them, that when the sick enter your peace, they may offer thanks to your great name. Give your blessing, gracious God, to those whom you have called to the study and practice of the art of healing and the prevention of disease and pain. Give them the wisdom of your Holy Spirit, that through your work, the health of our community may be advanced and your creation glorified. Through your Son, Jesus Christ. Amen.
Amen. Thank you, Kay, for that lovely prayer. And so tonight I'm going to ask our guests to introduce themselves, and we're going to start with Vernette Townsend. Hold on, Vernette, make sure you unmic. That's right, unmute your mic. Nope.
Can you hear me now?
Yes, thank you.
I apologize. I'm having all kinds of technical challenges this evening, but again, as well as Lynn said, welcome. Thank you for joining in this timely discussion. Looking forward to it. My name is Vernette Townsend. Currently, I am the Chief Nursing Officer at St. Mary's Hospital, Trinity Health of New England in Waterbury, Connecticut, and have had the pleasure of being a practicing professional nurse for 35 years. This has been of interest to me, of course, because of my own ethnic background and culture that I come from and what I've been able to see in 35 years. So looking forward to the conversation and sharing some of my own personal perspectives.
Great, thank you, Vernette, for joining us. And we have Marlene with us.
Hi, my name is Marlene Harris. Can you hear me?
Yeah.
Yes.
So my name is Marlene Harris, and I too am a nurse. I'm a nurse educator at Hartford Hospital. I've been a nurse too for 30 some years and have seen a lot of things in healthcare that I think we can improve on. So I think this is, again, as Vernette said, I echo, it's a timely discussion and hope that through this discussion, people will learn and be able to move forward.
Great, welcome. Thank you for being with us. And next we have Samantha Lew.
Good evening. Thank you so much for this opportunity to speak with you all this evening. My name is Samantha Lew. I am the Policy Analyst and Advocacy Specialist for Health Equity Solutions. I received my master's in social work at the University of Connecticut, public policy focused, and I've been with Health Equity Solutions for about 2 years now. So we are a statewide nonprofit. We focus on promoting policies, programs, and practices that result in equitable healthcare access, delivery, and outcomes for all people in our state. Thank you.
Thank you for joining us, Samantha. So let's start with what you've seen in your profession, right? If you could share a story with us about how you've seen healthcare impacted by race. And Vernette, you've worked in many different places throughout your career. Perhaps we'll start with you.
So when I actually did my initial nursing education back in the 80s, race and cultures were not a big topic. It was not discussed. There was a set way of teaching, and that's what you share with new nurses. And then you enter practice. And in my early careers, I worked in an inner city hospital where I could quite frankly say the patients did not look like the caregivers who were taking care of them. In a leadership role, something that impacted me and it stayed with me even till today, I was on a unit, and actually there was a new nurse who came, and the educators were working with this nursing group. But this one particular nurse who had an African-American male as her patient came out and asked the educator how she could easily tell if her patient had a fever. And the response from the educator was, well, of course, you look at the bottom of their feet and the bottom and the palms of their hands, and if it's red, then they have a fever. So, of course, I was incensed by that response, because the way you tell if anyone has a fever is with a thermometer. And the comfort that that educator had giving this misinformation to the nurses always remained with me. And I share the story to say, and this was not that long ago. We're not talking about 50, 60 years ago. We're talking about in the early 2000s. And I share that to show what still is pervasive out in our healthcare world.
Thank you for that story. Marlene, can you share with us a story?
Yes. So I think that what I've seen is that there's a definite difference when a person of color presents to ask a question regarding their health care. Many times they're perceived as being aggressive. They're not taken seriously. And there's certain answers are very different compared to a person that's not a minority. Also, I've seen even sometimes as far as when we're discharging patients in healthcare system, the information may be delivered differently and the perception may be differently. I had an occasion, I was coaching a nurse that was getting ready to discharge a patient, and she was, oh, well, she's not gonna come. She was already had in her mind she was not gonna come because of where she lived and what she looked like. So I said to her, well, I canceled my appointments. What makes that any different? So instead of asking the questions, what were the barriers of her not getting there? And it turned out that she was missing her appointments because she had added responsibilities to deal with kids, with extended families. So instead of going that extra mile to ask the question, the perception was already made and a judgment was made. So that, to me, that really impacted her continuing her health care.
Very interesting. Thank you. Thank you. And Samantha, can you talk a little bit about health equity solutions?
Yeah, so in late March, as the pandemic led to shutdowns across the state, Health Equity Solutions launched a community assessment survey in an effort to center the voices of people of color in Connecticut, specifically towards the COVID response and recovery efforts. So the results by month and details of the assessment are posted on our website if you're interested in our month-to-month analysis. It's It's at hesct.org. So the assessment results were updated weekly and shared with policymakers, decision makers, as well as our partners on a regular basis. And our executive director, Takesha Everett, also shared that ongoing results with the governor's emergency response teams that she was on. So the top four concerns that the community highlighted in these assessments were basic needs, outreach and engagement, mental health, and lastly, testing. So basic needs included the need for housing, food and supplies, such as formula, diapers, and cleaning supplies. Outreach and engagement concerns really centered around the isolation overall, as well as for older adults, immigrants, and people with limited English language proficiency specifically. Mental health was noted as a particular concern for the LGBTQ plus for youth and adults, healthcare providers, and then the undocumented community as well. And then lastly, concerns about testing included inadequate distribution of tests and the respondent knowing someone who didn't receive a test when they were initially symptomatic. And then lastly, the top four solutions that were highlighted really paralleled with the concerns. So we had outreach and engagement, access to technology, policy, and testing. Respondents consistently noted the need to ramp up contact with people of color through faith-based organizations, social service agencies, and increased utilization of community health workers and doulas in our communities. Universal testing through community providers and the need for more representation in testing and treatment were also raised. For technology, it was highlighted the increasing access to technology by distribution equipment such as cell phones and laptops were identified as a key means for ensuring access to care. And then finally, respondents suggested policy changes. These included a task force for people of color, collaboration with other states, so really learning from not just mistakes, but really being able to speak to one another and learn from one another as well. And then lastly, streamlining application systems for state-run services was highlighted.
From what I recall, many of these recommendations eventually got implemented. It didn't start off that way, but I think eventually they did. And I think we'll hear a little bit more about talking about testing in the community as well later on. I want to pause just a moment to let our participants know that they can ask our panelists questions by using the Q&A box. We are not using the raise hand feature or the chat feature. So type your questions in the Q&A box and we will get to them later in the presentation. So at our last gathering, we had an annual gathering and our office hosted Kim Mazik, and Kim Mazik was talking about Open Wider Hearts and racism, and she shared a quick story about maternal health care. And she mentioned how Beyonce and Serena Williams almost died of pregnancy complications, and now they're very strong advocates in health care, in regards to healthcare and speaking about healthcare inequities. And so I learned through her that in the United States, almost 700 women a year die of delivery complications in the US. And that itself is shocking. And then the fact that you are at risk for 3 to 4 times more if you are a person of color than a white person. That's according to the CDC. So let's talk about that a little bit. Why do you think that is? I'm going to ask Vernette to speak to that first. What's going on here?
So, you have to look at the names that you mentioned, Lynn. One would think that with the success that they've attained and the different lifestyle that they have would lend to a healthier outcome in their pregnancy. When you look at someone's health, a little over 70% of it is family history and genetics. And so Serena Williams and Beyonce actually are the results of history, a long history. And if you were to go back through their history, the inequities in healthcare that their parents have could have an impact on who they are today, regardless of where they've come in life. That's number one. And that's for those two individuals who happen to have famous names. If you look at, you mentioned a statistic about where African American women are in outcome after pregnancy, and you had a high statistic for negative outcomes. And there are reasons for that. And if you look in that group, in that culture, and I use Black sparingly because Black represents a lot of cultures and a lot of different histories. But something that's still very pervasive in that culture are the way healthcare looks at those individuals, how they make assessments, what they expect for their health practices, or what they just expect for these patients. And then again, the social determinants of health, where they're coming from and the impact it has on the outcome. There still is in these cultures a sense of a lack of trust of established healthcare institutions, whether it be doctors' offices, hospitals, healthcare clinics. And there's still a tendency to lean on what they've learned as children, right? We're adults that were started out as children. So what we were taught as what are healthy behaviors, what are eating practices that we're comfortable with, have resulted in who these individuals are now. Kind of in a roundabout answer to the fact that who we are today, we come from our history.
Very good point. Thank you. And Marlene.
I would agree. I also think it goes back to the perception of the healthcare giver as well. There's still the perception that if you're of color and you're seeking something for pain, you're already drug seeking. You already have a label. So as some of us that have experienced labor is so you do need some type of sense of pain relief. But the perception, I remember watching, I like watching the Today Show, and there was a study done by a group of physicians regarding the same question. And the physician actually said that the perception is when they see a person of color, they automatically think that the person is drug seeking. So without even speaking to the person, the perception is there. So I think that I could see where if you're automatically thinking that this person already has a different agenda, then you're not going to address what the presenting issues are at the time. You're going to go by what you're thinking it is without doing the assessment. As opposed to someone that doesn't meet that same culture, they may think, well, let me give her some pain medicine or give him something else to help them settle. But then if they have that fear or that misconception, then that's the way they're going to be treated. But I think that through definitely education and people understanding that everyone's very different. The same holds true not only with maternal health, but I can think of sickle cell patients. For years, sickle cell patients were viewed as drug seeking. They're coming in, they can't possibly need that much medication, but the disease entity itself creates a lot of pain. So I think when we look at healthcare, we absolutely have to look at cultural biases that you may have. And you have to address it because as healthcare providers, we're there to care for the whole patient. And that includes, just as Vernette said, we all come from various backgrounds. So to address those needs in addition to healthcare is crucial.
Thank you. Thank you. Very good point about the bias. And Samantha, I think you have something in regards to legal policy on this?
Yes, I do. Thank you. So Lynn, as you mentioned, the maternal mortality rate Black residents is rising at an alarming rate, specifically as well here in Connecticut. So one key policy that Health Equity Solutions has been and is highlighting is the need for equitable access to doula care services in our state and supporting pathways to reimbursement for community health workers. So working with and informed by a coalition of doulas in Connecticut, centering the work on experiences and voices of Black women and women of color. Health Equity Solutions' overarching goal is to advocate for sustainable funding for doulas and community health workers.
And just for maybe some of people in our audience aren't familiar with the term doula.
Yeah, thank you. I always keep forgetting acronyms not to use, but also just explaining different terms. So a doula, right off the top of my head, is an advocate. So they really help the individual, whether they plan to have a family or are pregnant or giving birth or have lost a child as well. And so they really know the birth plan for the mother. They can help them with meal planning as well. And so it's really a overall holistic care that they provide. They can help the individual while they're in the hospital as well. So really kind of the go-between healthcare providers and the mom, so they don't have to stress while they're trying to have a family.
Great, thank you for that, thank you. So another statistic that I learned is that the average life expectancy of African Americans is 4 years lower than the rest of the US population. So what are some contributing factors to this gap? And again, we'll start with Vernette.
So, again, I'm going to repeat something that the healthcare sciences accepts, that a little greater than 70% of your health and life expectancy is actually genetic and family makeup. The other part, the other great 30% that we actually can influence, you think about, there's a term that gets used often, social determinants of health. And what is a social determinant of health? It has to do with the environment that you live in, the availability of good housing security, food. Do you have access to healthy foods? Do you have access to good preventative health care? And then, is the environment safe? So when you look at the African American community and you think about the list that I just gave you as coined social determinants of health, predominantly when you look in our urban settings, there's a congestion of families in very small quarters, and there's food deserts, meaning that you don't have access to all the fresh produce, which contributes to health, right? And then in some of these urban settings where we have a concentration of African American, I'll say Black and brown community, not just African American, the housing standards are less than adequate. And I'll just give you some examples. You have some of the tenement housing apartment buildings where there, believe it or not, is still lead paint, or there is inefficient caulking around windows, and so moisture comes in and you have mold. You have pests, you have cockroaches that are in some of these apartments, and this is the housing of the Black and brown community in an urban setting. We know that all of these impact health. The cockroaches have been linked with a high incidence of asthma. You think about congested housing again, and parking on the street and cars idling, and those fumes are being breathed, and that's the environment people live in. And that's what I mean by the social determinant of health, and the social inequities leading to the poorer health outcomes. And we could go on and on and on, but I'm gonna let some of my other fellow panelists speak to this.
Thank you.
I would agree, and even along with that, I think being a person of color, in particular African American, I think stress is a lot. And I think about, I think we've all been watching a lot of TV of sorts during this time, but I was really felt very, a sense of understanding even more about myself. Especially there's a Procter and Gamble initiative, and there's a series of clips that come out, and there's the talk and the look. And I think about, you're growing up as a person of color, and you're exposed to different things in your life, but there's always that, but I'm Black, so I'm going to be looked at differently. So you have, and even as a parent, as a child going through life, you have a certain set of stressors. And even going back to what the first question about Beyonce, Serena Williams, even with their stature and their status, they still have those stressors. So I can see why the life expectancy is less, because there's more stress put on you, I believe. And I think that the more that we have these talks, and unfortunately through the death of George Floyd, I think these discussions have happened more, and it's shed more light on the inequities. So I really hope that people will learn to really talk to each other and not about each other, and to learn about the differences that we have, because we find that we have more in common than we have that are not in common. So I think that there's so much stress on all of us, but I know that being a person of color, I think sometimes there's even more because of the way we look. So I think that the more that we talk, the more that we understand. I absolutely think that our youth are the answer, because they're the ones that are asking the questions. And what I like about it, they're not taking no for an answer. I think when we were growing up, we were like, because I said so, and that was it. Now it's like, it's not because I said so, but I'm going to make a change, and I'm going to show you how it's going to be done. So I really look at our youth and really look forward to their lead, because they're definitely our future, and hope we can learn from them.
Great, thank you. Thank you.
Yeah, so just to echo on what both of the panelists had shared. So there are many forms of racism, individual racism and systemic, which can manifest in two different ways, so institutional and structural racism. Researchers have developed the analytical framework of weathering to describe how the constant stress of racism leads to poor health outcomes on the body. And again, just to echo what the two panelists had shared about social determinants of health and the importance of it as well.
Great, thank you. Yes, so certainly we're seeing many issues tying together, right? We're hearing about health, we're hearing about the environment, about where we live, and so many things come together, right? Nothing is independent, right? And so we have this healthcare issue, right? And many of our cities are beginning to say that racism itself is a public health issue. And even in Congress, we have a Senator Brown who's introducing a resolution to declare racism a public health emergency. So I'm going to ask my panelists, do you see racism as a public health issue? And if so, by declaring it a public health issue, is that of any help? Can these resolutions be of any help?
So we have to first admit that racism exists. And as Marlene mentioned, the incident with George Floyd is forcing a lot more conversation. So is racism a public health issue? Absolutely. Anything that threatens any member of a society threatens the society, because the health of a society is only as good as its members, not some of its members, but all of its members. So the fact that there are disenfranchised parts of society is a threat to society. Is talking about it enough? It's a beginning, because again, you have to admit that there's an issue before you can start working on it, but there needs to be more activity around addressing a health issue. We have a pandemic. We're living in our lives that have been changed, at least for now, because of it. And admitting that there's a pandemic and doing nothing about it won't get us to a place of better. And it's similar with racism. Admitting that it exists and not doing something about it, it will become pandemic, and the outcome will not be desired by any.
Yeah, I definitely agree. I think even for myself, when the pandemic first started, and being in healthcare, you see it from a lens of healthcare. So it wasn't until later into the story of the pandemic, when the numbers started coming out, it's like, wait a minute, this is affecting my community, my brethren's community, more than I even realized. So and then the other part of it is, sadly, on every chart, every statistic, every study, minorities were at the bottom. So testing wasn't available. That was a huge eye opener all over. And then people were being turned away. There was misinformation. It wasn't in languages that people could understand. So it kind of, again, ripped that Band-Aid off of an already seeping wound. So I think that moving forward, we have a long way to go. The numbers are still going up. Our minorities are still being hit very hard by this awful pandemic. And I think on top of that, with George Floyd's untimely death and racism, with all the social injustice rallies and everything, it's really been a very hard time. So I think that in addition to what's happening with social injustice and talking about racism, we really have to look at healthcare, because we keep saying it, and for as long as I've been in nursing and healthcare, it's always been there. And I think it's gotten more awareness, but it's still, as Vernette said, we have to have action. So, we can talk all we want to, but I think we really, really have to be serious. And as we move through this pandemic, we really have to embrace those that may not speak the same language, to make sure that they're getting the information that they need. I'm very privileged to be a part of the Northern Connecticut Black Nurses Association, and along with the National Association of Hispanic Nurses, we've been able to really go out to support the community. I'm a faithful member, as Vernette as well, of St. Justin St. Michael's Parish, and through our nursing organization, we've been able to distribute masks and education to the clients. And to see the looks on their faces, they're scared. We're all scared. I can tell you, as a healthcare provider, I'm scared every day. And I'm, hoping and praying every day that there's a solution, but not only to COVID, but a solution to racism, because we cannot move forward as a group of human beings, as Christians, if we don't address both problems. So I'm hopeful that maybe this is our rude awakening, but a definite wake-up call to say that we have to be called to action, be called as brothers and sisters in Christ, and move forward.
Very well said. Thank you.
Yeah, so just to give some background information, at least 18 Connecticut municipalities, as well as the Mashantucket Pequot Tribal Nation, and as of today, I want to say close to 70 healthcare systems in the United States have signed on to declaring racism as a public health crisis. And so when we say declaring, that can mean many different forms. Here in Connecticut, some towns have just passed a declaration, meaning that their town council members don't need to sign on to something. And then some towns have actually put forth a resolution, meaning that their town council members that have been elected actually have to vote to pass something like this. So the towns, the 18 Connecticut municipalities that have passed it, come up with a resolution that really works for their towns. Some towns have been looking towards their hiring processes, and then most of the towns, if not all, have something in their documents specifying on data collection. So making sure that moving forward, it's not just we're here to declare that yes, there is a problem in the United States. It's really enforcing a step forward. And as Marlene and Vernette said, being able to clearly define, yes, that there is a problem and having actionable steps to move forward. So some of the questions that are being highlighted are: what barriers to health are identified by people of color in your town or city? Is this information coming from diverse sources, and are you really utilizing any organizations or any communities in your town or location? And then lastly, how are people of color represented in decision-making bodies? Who's at the table? And more importantly, who owns the tables, and how can we get more people involved?
So if our attendees were working with their town council, then you would recommend moving towards a resolution versus a declaration, because the resolution has more action to it.
It does. This is really one way not only to hold ourselves accountable, but hold our elected officials accountable. Being able to document actionable steps that the town wants to move forward with is really crucial in the resolution.
Great, thank you. And so I'm going to put to all of you, we are here as Catholics, we're called to live our gospel, right? And we want to be able to do some action. We want to help. So what is it that we can do to help create better healthcare system, a more just healthcare system?
I think webinars like tonight is a great start because knowledge is power, and having a platform where people can talk with others who actually this is their daily living is number one, because what you pay attention to and what you put energy toward are things that you're going to work to defend. The other thing we can do is just to get involved, know where you can get involved, know what kind of action boards exist in your community, whether it's a social justice committee at your church, whether it's a board for some of your healthcare institutions or community agencies. There's community members on those boards. Knowing who are your voting representatives in your community and have conversations. Don't be afraid to have conversations and intermingle in all of this knowledge. Seek to learn as much about what is happening now and today. And then just make a commitment to be active.
Thank you.
Yes, I would agree. And I would also add to ask. I think sometimes we rely too much on social media or TV or caricatures or whatever. So instead of going by what you see, ask the person. If you're not sure of a culture or not sure of a custom or something, ask the person. That's how you learn. As I said, you find we have more in common than we have differences. So even, for example, I remember a story when I was managing, I'm from New Jersey, I always say that, so. And we had lunch. This was way before COVID, a long time ago. And as people of color, we eat soul food. So there was we had Filipino nurses, Black nurses, white nurses, very multicultural staff I had. And I remember one of the Black nurses brought in a dish. And the Filipino nurse said, "You eat that? We eat that too." And they found out just by talking, it was a difference of how it was cooked. It was the same food item, but it really created a lot of discussion. And from that, we actually had an international day and people brought in dishes from their meals. So instead of, insinuating or being upset that somebody ate, what is that? And you're, not asking the question, they learned a lot about each other's cultures and found that there was a lot in common. So I think just sitting down to ask people instead of thinking that, if you see a person of color looks a certain way, they have to be this. So ask the question, sit down and talk to people. I think having conversations other than a text or an Instagram, but having that verbal conversation, socially distant and with a mask, but having a conversation will really hopefully break down those barriers of racism and have more people coming together.
Very good. We've been talking about that, how we should have conversations among the different parishes within the diocese.
Awesome.
So on the policy side, I would say community-informed policies are crucial. They're really, really crucial to if we aim to address community needs and really avoid unintended consequences. Communities must have the opportunity to voice their concerns and really help decide which policies shape their experiences. So storytelling is really important and vital. If you're interested, your town council potentially could meet once a month. Some towns vary, including during COVID. They might extend how often they meet. Legislation starts in January, and so there are public hearing opportunities where you can submit just your suggestion towards a policy item that you're really interested in pushing for, and also just emailing your legislator and sharing your experiences and what you would really like to see happen in your state. Yeah.
Very good. We're always encouraging, now's the time to build your relationship with your legislator. Let them know what's on your mind. So we have a lot of questions that came up. I will read something, and maybe you, our panelists, can just jump in, whoever is willing to take on the question. The first one I have is someone who has a relative who has sickle cell anemia. And she's asking, what could that person do? What could a relative do to convince healthcare workers that they are not there just for the drugs?
I see and hear that a lot, and more and more hospitals are looking at pain and in a more global sense. I think that being an advocate is for yourself is going to be key, but there are also levels of healthcare that can help out. So I know the health organization that I'm in, the pharmacists, there are pain management pharmacists that are more in tune to sit down with you to talk about medication options. I think some of our healthcare facilities have people that are actually specialized in sickle cell because it is an evolving disease. There's not even right now, there's more treatments that are becoming available to help with the disease. So it's very difficult, but I know that more and more, especially linking with pharmacists, there's more pharmacists that definitely will partner with patients to find out the best medications to decrease the pain.
Great.
I would agree with Marlene. I just like to add the advocacy is a very strong tool, and so if you're the family member, to go in when your family member's in pain, it's probably not the most opportune time for that person to communicate with a healthcare provider. So to have you as an advocating voice come in that moment, and then go in there with some information, some knowledge, as Marlene said, whether it comes from a pharmacist, whether you've read something or talked to someone else in a sickle cell support group, go in there with some knowledge. So the healthcare person's not the only one driving the conversation. It becomes a bi-directional conversation, and you two have your information and have an open conversation. The healthcare person will begin to respond to your ability to communicate with them very objectively about what's going on.
Great, thank you. So here's another question Ben wants to challenge. Have you experienced pressure on Black or Hispanic women after they've given birth to undergo a tubal ligation? Yeah.
Wow.
Yes or no, or never came across?
No, I will jump in and say I've actually not experienced any of that currently, definitely not now, because I'm working in a Catholic health organization. But even when I was not in a Catholic organization, that actually was never a pressure that I experienced, saw, witnessed, or heard discussed.
Well, I think my answer is kind of mixed. probably never haven't heard a particular patient being pressured. However, I have heard healthcare providers insinuate to say, "Oh, well, gee, they have all these kids. Why don't they get a tubal ligation?" So, in a sense, that is being pressured of sorts. They may not have said that directly to the person, but the conversation or the sidebar conversation in that. So, hopefully, again, through that conversation for people to intervene, and we've asked that question. It's like, well, why are you saying that? And then sometimes, unfortunately, that's when you hear the bias. Well, those people, and you hear those unfortunate comments. So that's the time when we have to educate to say that, your biases is really having an effect on the care for that patient. So where I haven't heard anyone being forced into it, I have heard conversations, unfortunately, insinuating that.
Okay, thank you. And there's another question about the nursing field and healthcare professionals, right? So within your field, is there a need for greater representation of people of color?
I'm going to take that on because there actually is a lot of literature in the medical journals and the nursing journals, and actually in the psychiatry, research area and social services research about the impact of having the caregiver look, sound, and have lived experiences like their patients. Or clients, however you want to refer to them. We have a long way to go, and actually organizations have had to set targets and goals to guide leadership to ensure that they do have a diverse workforce, and things are improving, but also slowly and nothing to write home about. And it's even weaker in the leadership, because not only do you need the caregivers, but you need the leadership. You've heard commentary that those that are making decisions have to have had some of the lived experiences, and they have to look like those that they're making decisions for. There's still significant opportunity in having leadership in healthcare industry look like the patients that they're serving. So it is important. And there's a lot in literature as to why it's important.
Thank you.
Yes, I definitely would agree. And also, it also starts, well, we see this too with our nursing students. Not a lot of our nursing students look like us. And it even starts when you get to the middle school, grammar school, high school. So we need to start telling our kids, especially our kids of color, that yes, you can be a nurse. It's not always a path that every child, Black child that's of a certain height is going to be a basketball player. So maybe you can definitely be a basketball player and a nurse. But we need to tell our kids, especially our kids of color, yes, you can do this.
Thank you. And so I think this question might be for Samantha. Maybe you want to type this in the chat for people. A question about where to find draft resolution language.
Yes, I put it right in the chat. So on our website, there's information on how to get in contact and the draft. So we have a sample resolution language, some templates to email your town council if you're interested, and also how to really ask your town to push for this.
I'm just scrolling through questions here. Someone backs up to the conversation we had earlier about a doula. Just kind of curious as to how receptive hospitals and Medicare providers are to having a doula, because it does certainly seem like a very good idea to be having an advocate for the patient.
So from my perspective, I am not a doula. I work with doulas and doulas of color. So from my understanding and what I've been shared is that for one, the doula profession is not defined in statute. And so it's really tough to understand what a doula does and what a doula does not do. So a doula is not a medical professional. And so being able to do that here in Connecticut. Some other states have passed a definition and also a scope of practice in other states. And so we're really trying to build the profession here in Connecticut to define them and also be able to, in detail, put in statute what they do and what they don't do. And so again, back to the community informed policies, with putting any profession in statute, we really want to ensure that we are avoiding any barriers to any type of doula that wants to be defined and be able to eventually get Medicaid reimbursement. So we pushed the first bill 2 years ago, so it is it's moving. It's moving slowly, but we are moving nonetheless, and working with legislators.
Thank you. So a couple months ago, we did have a webinar on what Father Joseph Shea gave in regards to the racism within other communities, right? Not just African American communities, but the Asian American community. And so one of our listeners is asking if any of you had experiences within the healthcare system about other minorities in addition to African Americans, such as the Asian American community. You know, it's a mouthful.
Yeah. I'll take this on a little bit. There is a lot of unconscious bias. Some of it has impact on others and some don't. You know, we do have unconscious bias. And so where the other communities, I'm going to share what I've experienced, comes when English is not the primary language for the person coming into for healthcare, because in order to communicate with that person, there's a few extra steps to get the translation where both parties are understanding each other. And then for the caregiver, that can be perceived as additional work in already a very busy work life. And it sometimes impacts the relationship between the person who does not have English as their primary language and then the caregiver who does have English as their primary language. An attitude change, extent of the work that's done or the care that's given to that person is impacted. That's where I see the greatest probably impact.
Great, thank you. So I'm probably got time for one more question. I'm scrolling through them all. Certainly there's a lot of comments here just thanking you, especially being nurses during this COVID period. Any comments about neighborhood primary care centers versus larger health systems as ability to reach minority communities?
The fact that the healthcare center is in the community oftentimes makes it more palatable to the community because the community tends to trust where they live. Those healthcare centers are not subpar. I'd like to put that out there because all healthcare centers and facilities are they have to be in compliance with a lot of healthcare regulations, regardless of where they are. So they're not subpar. Now, they may be limited in the amount of services they can provide based on where they are and how they're equipped. But they are healthcare centers within a community. It's a good place to start, and they could make the connection with a larger healthcare institution that's not in the patient's primary community if the need is there.
Okay, great, thank you. there's a question for Samantha. Just curious if you were working with any organizations in regards to these resolutions besides the healthcare equity that you work for.
Yeah, so for starters, I just want to make it clear that we are not the only organization working on this. There are a lot of community-based organizations throughout Connecticut that are trying to push for this. And so what we're doing is just trying to ensure that town council members have the tools that they need, reaching out to different organizations and making connections. This is all about, as Marlene and Vernette both shared, the importance of really talking to one another. And so with declaring racism a public health crisis, it really starts with a conversation. And so if you know of any other organizations or individuals that would like to connect, please reach out. I am more than happy to have a further discussion.
Great. Thank you. So I'm going to take this time to thank each of our panelists. This, Open Wider Hearts calls us to do active listening, and you provided all these attendees out in this cyber world here an opportunity to really pay attention and listen to what you had to share, and that's a gift to us. So thank you very much for that gift. Thank you for your expertise for this very important discussion that we had this evening. I'm going to invite all our attendees to our next webinar, which will be on January 13th, where we will be talking about race and human trafficking. These are two different issues that our office has been working on, and there is an obvious intersection between them. So I hope you can join us for that. And until then, I wish everybody a lovely Advent and a very happy and healthy Christmas and New Year. Thank you again.
Thank you.
Thank you.